Good day. My name is Imelda Williams. This is the feedback on the cervical spine practice bank that I have given you. Please have your opinion form at hand so that you can self-mark as we go along. So for case 1, we have a patient who was in a car accident and now has tenderness over the cervical spine. So for this case, there's only one image available. And I'm just going to zoom in a little bit here, and then I might just adjust the windowing as well. Okay. So if we look at this case, we can see that the anterior vertebral line seems intact. And then when we get to C2, because that is C1, we can see that there is a break in the cortex and we have a fracture at the inferior vertebral corner of the anterior part of the vertebral body. We can also note as we look at the posterior vertebral line that there is a slight step from C2 onto C1. The spinal laminar line seems fairly okay. So this appearance is very typical of a flexion teardrop fracture. And this looks very simple, but as I said in the presentation, this is the most severe type of injury for a flexion mechanism of injury. And these patients quite often have neurological damage. There is also some evidence of pre-vertebral swelling as well. So your overall comment for this case should be, so if we first look at the ABCs, there is an alignment issues because we have that small step in the posterior vertebral body. We have fracture of the bone, and this of course also affects the soft tissue. So the comment for this is then there's a flexion teardrop fracture of the C2 vertebral body at the inferior, anterior inferior corner of the vertebral body with some pre-vertebral soft tissue swelling as well. And then for case 2, we have 3 images with this case. And this is a patient who was in a car accident, the airbag deployed, and now has diffuse tenderness over the cervical spine. So on the AP view, if we check for alignment, we can see that the spinous processes are fairly central. And if I just remove that, we can have a look at the vertebral body heights. And the vertebral body heights, there's no dramatic drops in the vertebral body heights on that AP view. Okay, now let's move to the next image. So we have the lateral view. And on the lateral view, the anterior vertebral body height, the intervertebral disc spaces, posterior vertebral line, the spinal laminar lines all seem intact, and there's no evidence of pre-vertebral soft tissue swelling. And then on the open mouth view, we can see that the lateral masses of C1 and C2 aligns with each other, and also that there is the spaces from the lateral margins of the dents to the lateral masses are equal there. And then on this image, you might think that there could be something there, but this is just the Mach effect. So this is a normal case. So the only thing, because there's no evidence of a fracture or any signs of dislocation. So for case 3, and this is a patient who was in a high-speed car accident I'm just going to go to the first image, which was taken higher up of the cervical spine, and we can see that that seems fairly normal. There's no signs of any fractures on that case. And then lower down, so I am just going to manipulate the windowing again, just get it a little bit lighter. That's better. Okay. So here we have see 1, 2, 3, 4, 5, 6, and then there's a big step from C6 to C7, and there is no evidence of a fracture here. So this is a facet injury. However, the issue is now, is it a unilateral facet dislocation, or is it bilateral? And if you remember, if it's less than 50%, it would be unilateral. If it's more than 50%, it would be bilateral. This is a borderline case, but it does appear that it borders on 50%, so that this appears as if this is a bilateral facet dislocation of the spine, and of course that makes it an unstable spine. So in your opinion form, the alignment has been affected. The joint space, of course, has also been affected. So overall, it's a bilateral facet dislocation of C6, C7. And then case 4, this is a patient, an elderly patient with an unobserved fall. And there's only one image for this case. Let me just maybe zoom in. It's quite obvious here that there's a lot of degenerative changes in the spine, but the main thing is that there is a big step from C1 going on to C2. So we have a dislocation of C1, C2, or you could also say that it's an atlantoaxial dislocation, and then you could add that there's marked degenerative changes basically in the whole of the spine. So it affects the alignment, it affects the bone, of course, and the disc space, so the joint space is affected. Our final case, and I think I will first start with the open mouth on this one. So quite useful to now look at how the lateral masses line up. So on the left side, so that's C1 lateral masses, looks fairly okay, but if we look at the lateral masses on the right side, we can see that there is a big discrepancy. So we have got overhanging lateral 1 masses on C2, and then we also have a discrepancy in the distance of the lateral margins of the dents to the lateral masses of C1. This, of course, is in keeping with a Jefferson's fracture, or a fracture of C1 and malalignment of C1 on C2. The other important thing here in this case, and I'm just going to zoom in a bit, is that it appears almost as if there could be a fracture at the base of the dents. However, this is a Mach effect. So just looking at the lateral view then. So on the lateral view, you'll be able to see that there is a fracture through the posterior arc of C1. So in your form then, the alignment has been affected. We've got C1 lateral masses overhanging C2. The bone has been affected because of the fracture. And then, of course, it affects the joint space of the atlantoaxial joint space. And then the overall comment is, you could write here that this is a Jefferson's fracture, or that it is an a C1 fracture, sorry, with malalignment of C1 on C2. So that brings us now to the end of the 5 cases that I've given you. If you've got any questions, please feel free to contact me. Thank you.